Hi guys, this is Dr. Nida with Keys of Health. I hope you're safe, healthy, and happy. As we know, COVID cases are surging pretty much all over the world once more. This is a good time to remind ourselves about how to care for family members who might be tested positive and how to care for ourselves while taking care of them. It is very important to be alert about our own health while taking care of a COVID positive family member. This is time to be rational, not emotional. As hard as it may be, we have to put our emotions aside and use our mind. It is a good idea to talk as a family about the possibility of an infection and how the family is going to address it. I speak from experience. I was working with a family back in May when we were still dealing with the first big wave of COVID. The father contracted the virus and went in isolation at home. A few days later, his 9-year-old daughter developed the symptoms and was tested positive. She was ill, refusing to isolate in her own room, so they stayed together in one room until he tested negative and could no longer stay with her. The little girl was getting upset at the idea of being all alone, and understandably so, and her mom couldn't take it. Long story short, mom let her emotions get the better of her and didn't maintain her distance and ended up in hospital with severe COVID symptoms. When you are taking care of a COVID positive family member, especially in your own house, you are at high risk. You can't afford to neglect yourself. I will share with you some ways you can take care of yourself to limit your chances of contracting the virus. Let's start with how you can take care of the infected individual first. Isolation is the key here. They must remain isolated from the rest of the family and ideally should have a separate bathroom. If you don't have a separate bathroom for the person, make sure there's a disinfectant spray in the bathroom and they spray the surfaces like toilet bowl and sink after using it. Make sure they're in a well-ventilated area, preferably with direct sunlight exposure. It makes such a difference. If there are pets in the house, make sure that they don't come in contact with the infected person. There have been cases of animals turning up COVID positive. It is a precaution. It is always better to be safe than sorry. Have their doctor's number handy. Contact the doctor if person gets sicker. I will share with you some of the symptoms to look out for in a moment. Going back to taking care of the COVID positive individual, do their laundry separately from the rest of the family and give the clothes additional 10 minutes or so in the dryer. Wear gloves when you touch or have contact with the sick person's blood, stool, or body fluids such as saliva, mucus, vomit, and urine. Whenever you go in the room to drop off food or anything, go with a mask and don't linger. In and out is the best. Minimize the contact as much as possible. Chat all you want from the other room or do video chat, but don't be in the same room. Make sure the room is aired out regularly and bed sheets and pillowcases are regularly washed and all the surfaces are disinfected daily. Simply wiping them with disinfectant wipes is sufficient in most cases. Give them food in their own room where they're isolating and wash their dishes separately, preferably using a separate sponge, which you then disinfect. These might sound over the top, but these are precautions we take for any contagious disease like shingles or chickenpox. I'm not paranoid by any means, I just prefer to be careful. Serve the ill person healthy foods and only warm foods, nothing cold. No ice cream, no cold drinks, none of that. Instead, plenty of soups, warm drinks like ginger tea, lemon water with some honey, foods cooked with lots of herbs and spices like garlic and ginger, cloves, cinnamon, star anise, bay leaves, things like that. Avoid giving them dairy products like milk and cheese because they tend to produce mucus in the body and it is something you want to avoid as much as possible. In my previous video, I have shared with you foods that are great for boosting our immunity during these days. You can serve the whole family same foods, no need to do extra or special cooking. I also did a video at the beginning of the pandemic when hospitals had reached their capacity in New York City and were turning people away on how to treat COVID at home. You can check it out and incorporate these suggestions. It has helped hundreds of thousands of people and you will also find it very helpful. Another thing is disinfecting the environment. There are a few natural ways you can do that. If you have access to fresh neem leaves, leaving a few stalks in the room, and bathroom of the sick person is great. You can also hang a few stalks of eucalyptus leaves in the bathroom, as it also helps keep the lungs clean. Going back to neem leaves are amazing. Studies have revealed that neem leaf smoke has antimicrobial properties and could be used for controlling airborne microbial contamination. So burning the neem leaves like incense is a natural way to disinfect the environment. But be careful, it will create a lot of smoke, so make sure the windows are open and also watch out for smoke detectors. They might go crazy. By the way, neem leaves are also great insect repellent. If you have issues with mosquitoes or flies, you can burn some neem leaves to get rid of them. The best way to use them is to crush a couple of stalks of fresh leaves and put them in a deep metal bowl or wok, and either light them up so they smoke, or put a small piece of burning coal at the bottom of the wok and put fresh leaves on top to burn them. Personally, I prefer to just light the leaves. Once the leaves are smoking, you can walk around the house with the bowl to make sure the smoke spreads everywhere. You can do the same with bay leaves, but use dry bay leaves, not fresh ones. Now, as a caretaker, you want to look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. If you notice trouble breathing, persistent pain or pressure in the chest, signs of confusion, inability to wake or stay awake, or bluish lips or face. If you notice any of these signs or other abnormal signs in them, call their doctor immediately and follow their advice. Even if the person is no longer displaying any signs, it is best they stay in isolation until they test negative. After they have tested negative, continue with the diet and supplements that I have shared with you in my previous video. It takes a while to build back immunity and to regain energy. Last thing you want is a relapse because of poor immune system. Now let's talk about you, the caretaker. Caretakers can get tired and burned out. And that is a big problem. Once you're stressed, tired, and your body gets weaker, you're more susceptible to contracting all kinds of diseases. So it's extremely important to take good care of yourself. Make sure you eat well, sleep enough, and ask for help when you need it. Don't try to do everything on your own. Once you ask, you will be surprised at how many people are willing to help. Some of the ways you can maintain your immunity is by taking a few supplements. Take vitamin C, 2000 milligram daily, preferably liposomal vitamin C. Take vitamin D, 5000 IU daily. Take zinc, preferably zinc picolinate, because between 15 to 30 mg daily, because it's more easily usable by the body. On top of that, you want to take manuka honey, or if you can't find that, any raw, unpasteurized, organic honey. Carob molasses is great for lungs, and lots of warm drinks like herbal teas or ginger turmeric tea. Also steam inhalation and salt water gargling. These are all good practices at this time. And as a caretaker of an infected individual, you need them more than anyone else. I hope you found this video beneficial. I'm confident these simple suggestions will help your family overcome these difficult times with ease. Don't hesitate to get in touch if you have any questions or concerns, or if you're interested in getting a consultation. I'm here for you, and you've got this. I've seen many amazing families overcome this virus, and they came out stronger. I know you will too. Take good care of your loved ones, and don't forget yourself in the process. See you shortly. Until then, goodbye.